Right. Hello, people. I am here with Dr. Gozi tonight and want to talk about something very important that's been, we see it happening all the time, but it's just way too much. So we're ready to talk about it. And this is to highlight how not to recover quickly. Things that people do that will stop you from recovering quickly, whether it's from any pain you're having with any musculoskeletal issues, which Dr. Gozi deals with, or with your chronic health conditions, right? So scene one, act one, scene one today. A patient comes in, pain, whether it's in the back,
right,
and did some work, needling, some cupping, things supposed to help open the back up. And the thing is, once you have that type of work done to your muscles or any joints, people want to go back out in the world and do things exactly the way they were doing things before. They don't want to miss a beat. They don't want to miss work. They don't want to take time to rest. And I'm like, okay, take a minute and stop. Because I think, just to be nice, I'm sweet, right? Even a child would understand that. So you just got some work done. The muscles, things are stretched out, it's supposed to be healing. The muscle's going to be, trying to get some blood flow in there, take out all the toxins. And then you run back out in the world and you go back to work. And you're stressed out and your brain's going all over the place. Your nervous system's going all over the place. You're producing more toxins. The body's getting more acidic and the muscle gets all that acidity around it and it's just going to cramp right back up. The faster you do that, the faster it's going to cramp right back up. This is the same thing even with the healing process. I had a patient today. He's diabetic. Feeling better, more energy. When he came to see me, he was not able to leave the house because of how tired he was. And today he's like, I'm still tired. I'm like, but what happened? Now he has a full-time job. He's working nights. He's doing all these things. And I'm like, you got to give yourself some time. You got to rest. You got to sleep. You got to take some time for the muscle and the body to actually recover. And part of the problem is, so you can tell, I talk a lot when it comes to this type of things. I really do. Because people don't understand that when things like this are happening, they want to attribute it to just one particular thing that caused the injury. Or this one particular thing, whether it's the food that created the situation with diabetes or your blood pressure. Not realizing it's a series of multiple events, of which the major things that they're ignoring is even just the nervous system and how stressed it is. And so they want to take care of, okay, just take this care of this one thing. And while we did it, you're going to run back out there and do all these other things that are actually big contributing factors. And then you wonder why you're not recovering well. You wonder why you're not healing. You wonder why you're not taking the time. Like nothing's working for you. But that's part of the problem. You need to change the way you're approaching things. You need to be patient. And sometimes the process of going through the healing, especially when you're working with me, you will get to find out a lot more about yourself and your life and what put you there in the first place that you didn't even understand. And that is part of God's plan for you coming to see me, to make those situations clear, to open up aspects in your life where you need learning. And any of my patients that have taken the time to understand the importance of those things have done exceedingly well, not just in their recovery process, but in their lives. And so I wanted to talk about that today. Because some people come in, they want to see Dr. Gozi. He gets a check medical scan, trying to talk about your gut, it's a problem. You got some parasites, the problem. Well, it's just my shoulder. Do you really think your gut is not affecting your liver, which is not affecting the shoulder? Everybody knows about shoulder and referred pain from the liver if there's inflammation, or your back and it's not related to your kidneys and how it's not flushing out toxins and it's getting inflamed. Yes, your blood work is normal, but it's still happening. The blood work is just waiting for it to be so abnormal before it tells you, okay, well, maybe now you need prescriptions. Anyway, my main point, why you're not recovering as quickly as you could be, take some time after you restart to go through a healing or recovery process to rest, to allow your body heal. Don't jump back into things that will especially stress you out. And if you really want to learn how to work on that level, come see me for some breathwork stuff. It'll change your life. Yeah, I had a sister that was a skeptic. She would tell you differently now. She would. Okay? Anyway, that's what we wanted to say. Dr. Gozi, do you have any words for the people out there?
No, I just want to be eye candy. No. So she has a point. From my perspective, a lot of people that I deal with, you know, they come in either in a lot of pain or joint mobility problems, and they feel great after that first visit, and they're like, I feel like Superman or Superwoman, and I could get right back into it. And I'm asking them, okay, what are you doing today? Are you going back to work legs and back? Yeah, I feel great. I'll be seeing you 2 days later because it's going to flare right back up. Guess what? Because I want you to always give your body a break after we work on something. It's the same thing. Like, while you're healing, you got to take a break. That's why Dr. Enize teaches the breath work and teaching people how to recover while you're out of the clinic. You're only there for maybe about 1-2 hours with us in a 24-hour times 7 week. Think about everything you're doing outside the clinic. That is part of your main healing. That's my message to you today. And stop giving me, you want to come in, I want to pick and choose how I want to do my therapy. Do I pick and choose, okay, I'm not going to put this cup on you because you don't want to pay for this?
Oh, stop it. Listen.
I'm just saying.
No, but listen, no, guess what, though?
As you were talking, pick and choose what you want to do.
I know, but...
I pick and choose your plan, like, okay, we're not going to do this today.
You know, people are going to be people. But listen, as you were talking, I just remembered, like, even just me, like, I'm guilty of this. We had to learn from this, right? Because, you know, as both of us healthcare professionals, like, especially me with my ninja moves when I'm doing my workouts, I will hurt myself. And I got him, and he does work on me right away. And I will want to run right back into it. This is coming from experience, not just with me, not just from my patients, but me. Like, I had to learn this. This is why I had a torn ACL that I'm not doing surgery on. And I have taken a step back for 2 years, not to do martial arts that I was doing and a few other things, to allow it to heal. And even when I went back the other day, I still kind of went on like rapid fire too. But Master Ron better not watch this video. Master Ron would be like, "You're talking out here." I do practice what I preach, you know, and that's why I'm sharing that it's very easy for you to just get caught up when you go out there. Do your best not to do it. It'll save you not just in the short term with recovery, but it'll really save your life. This is what they call quote unquote anti-aging. No, it's just aging well. And it starts with all these little things you do today. So that's our message for today.
Yes, it is.
I had fun doing this.
All right.
We need to do this regularly. What do y'all think? Like once a week, come in here and put things together for y'all? Let us know in the comments. Drop it in the comments box, okay? Have a blessed evening, everybody. One love. Ashe.